Overview of the Affordable Care Act by Will Jackson. The concept of the Patient Protection and Affordable Care Act, the ACA, was founded on the principle that every American, regardless of social determinants, had a fundamentally equal right to high-quality, low-cost health care. On March 23, 2010, President Barack Obama signed the ACA into law. Before the ACA, low-income families often went without healthcare coverage, utilizing emergency room visits as their primary source of healthcare and often leaving unpaid medical bills, causing the financial burden to shift to those who pay for healthcare services. In fact, prior to the ACA, approximately 16% of Americans did not have health insurance. Once Americans were able to benefit from the ACA, that number dropped to 8%, covering an additional 25 million Americans by 2017. This number includes 8 million people who signed up for private health insurance through the marketplace, another 3 million young adults who received coverage through their parents' plan, as the ACA now allows parents to keep their children on until the age of 26, another 3 million Americans who received coverage through Medicaid and CHIP, and an estimated 5 million Americans who received coverage through private health plans who would have not otherwise qualified for health coverage due to pre-existing conditions. Here are a few notable facts about the Patient Protection and Affordable Care Act. The ACA created a marketplace for all Americans to purchase private health care insurance with group rates. The ACA removed the lifetime maximum benefit from healthcare policies. The ACA provides subsidies for low-income families purchasing healthcare insurance through the marketplace that would pay up to 100% of the cost of the premium. The ACA required parents' policies to allow children to be covered until the age of 26. The ACA removed exclusions and denials based on pre-existing conditions. The ACA required small businesses with 50 or more employees to provide health care to their employees. The ACA required preventive care such as annual wellness visits, immunizations, mammograms, and colonoscopies to be covered without cost share to the member. And the ACA also legislated Medicaid expansion, which lowered the restrictions to qualify for Medicaid. What is the status of those newly covered under the ACA? When the ACA first became the law of the land in 2010, an estimated 25 million Americans gained coverage. The people who became newly covered under the ACA were largely low-income families, young adults, new Medicaid recipients due to the expansion, and unemployed and underemployed Americans throughout the nation. However, in June 2012, the U.S. Supreme Court ruled that it was unconstitutional for the ACA to mandate Medicaid expansion to their state's residents. And as such, 10 states decided not to adopt the Medicaid expansion, including Texas, Florida, South Carolina, Georgia, Tennessee, Mississippi, Alabama, Kansas, Wyoming, and Wisconsin. This caused over 3.5 million Americans to lose coverage through Medicaid. Regardless, as of 2022, there were reportedly 35 million Americans now enrolled and covered under the ACA, with a historic 21 million Americans now enrolled in Medicaid. This reduced the uninsured rate of U.S. Americans in the U.S. to an all-time low by the end of 2021.
What are exchanges and how different states approach them? By Justin Gooden. Health insurance exchanges established by the Affordable Care Act facilitate the shopping for and purchase of health insurance policies by individuals and small businesses through online marketplaces. Small business healthcare exchanges help reduce some barriers to accessing relatively affordable healthcare coverage in the small group market. By pooling risk among multiple business and reducing administrative costs, average insurance costs could reduce costs for these firms. You may find many different kinds of private insurance plans on these exchanges, and you can get subsidies to lower the cost of coverage. Another valid point, the states have taken diverse approaches to the exchanges. Several states have set up a state-based exchange to serve their residents better and ensure compliance with state law. The federal government runs the program when states choose not to establish their exchanges. On this slide, these are states in which state-based healthcare insurances are influencing their marketplace. Those states consist of California, Colorado, Connecticut, the District of Columbia, Idaho, Kentucky, Maine, Maryland, Massachusetts, Minnesota, Nevada, New Jersey, New Mexico, Pennsylvania, Rhode Island, Vermont, and Washington State. Beside each state is the name of the health insurance marketplace. On this slide, the states listed are associated with federal government-backed programs. These are states which currently use federal government-based health insurance marketplaces. Those states are Alabama, Alaska, Arizona, Florida, Hawaii, Indiana, Kansas, Louisiana, Mississippi, Missouri, Montana, Nebraska, North Carolina, North Dakota, Ohio, Oklahoma, South Carolina, South Dakota, Tennessee, Texas, Utah, Wisconsin, and Wyoming. State-based marketplaces that use federal enrollment platforms are Arkansas, Georgia, and Oregon. States that use federal healthcare.gov enrollment platforms are Delaware, Illinois, Iowa, Michigan, New Hampshire, and West Virginia. This concludes my section of the PowerPoint. Thank you again.
This is Beatriz Gonzalez, and I will go over what does the Medicaid program have to do with the ACA. The Medicaid program is closely linked to the Affordable Care Act through several key changes. The ACA expanded Medicaid eligibility to include adults with incomes up to 138% of the federal poverty level, which was initially a requirement but made optional by the Supreme Court ruling in 2012. Many states have chosen to expand Medicaid under the ACA, and the ACA also implemented other changes, such as preventing states from reducing children's Medicaid eligibility until FY 2019, setting a uniform standard for children's eligibility, streaming eligibility processes, and updating payments to safety net hospitals. As of today, 10 states have chosen not to expand Medicaid, resulting in a coverage gap for low-income individuals who do not qualify for Medicaid but do not qualify for ACA subsidies. The ACA also included provisions to strengthen and improve the quality of care provided by Medicaid, such as promoting preventative care services and increasing funding for community health centers. These measures aim to increase access to health care for low-income individuals, improve health outcomes, and reduce long-term health care costs. Overall, the expansion of Medicaid and the emphasis on quality care under the ACA were significant steps towards achieving a more equitable and effective healthcare system in the United States. How have health insurance premiums been affected? Before the Affordable Care Act, health insurance companies were able to increase the premium rate as high as they wanted and deny customers with pre-existing health care issues. Individuals or employers were paying high costs for insurance for too little to no coverage. These increases have forced families and employers to spend more money, often for less coverage. And many times, insurance companies have been able to raise rates without explaining their actions to regulators or the public or justifying reasons for their high premiums. Since the Affordable Care Act of 2010, health insurance companies have to explain the reasoning for increasing premiums to customers and get approval from the states before enforcing the increase in premiums. The Act ensures that in any state, large proposed increases will be evaluated by experts to make sure they are based on reasonable cost assumptions and solid evidence. What variables are in play in the political debate over the impact of the ACA on the cost, access, and quality of care? The authors of the ACA Act recognized that there was a need to develop a mechanism that could slow the growth of healthcare costs. Therefore, to understand the impact of the law and the potential effects, it is vital to isolate the impact of ACA from attributable to economic recession and recovery. Hence, the variables that are in play in the debate over the impact of the ACA on cost, access, and quality of care include medical coverage of low-income populations, the health insurance premiums and subsidies, the effect of the Affordable Care Act on Medicaid, the overall reduction in the percentage of the uninsured. Within Congress and the executive branch, there is a partisan divide between those who contend that the role of the government in the healthcare system should be reduced, as this would lead to more savings, and others who assert that greater free market influence will lead to increased costs, substandard quality of care, and fewer people who are insured. Following the 2016 presidential election, many attempts were made by the Republican Party to overturn the ACA. With a newly elected president who had a very contrasting opinion on the role of government in healthcare coverage and a newly constituted Congress, the debate focused on plans to control costs and the detriment of reducing access to care for others. 71% of Republicans were calling for the government to entirely hand off healthcare, repeal ACA, and reduce Medicaid costs, while 79% of Democrats were in support of the government's continuous participation in healthcare, as well as further expansion of government programs to enable more people access care. The American Health Care Act, proposed by the House of Representatives, and the Better Care Reconciliation Act, proposed by the Senate, are two bills that were proposed to overturn the ACA, but were ultimately defeated in part due to the rising popularity of the ACA. Many do not want to see the ACA overturned, but rather expanded with additional coverage options, and some who do not want the act overturned would like to see some provisions, such as a pre-existing condition protections, remain in place. Previously, patients would either have to go without care or face costly medical bills if they needed to see a doctor without insurance, and the ACA would provide these patients with a system that allows them to find affordable insurance coverage. With Joe Biden taking office in 2021 and making campaign promises to continue to reform healthcare, the debate should shift from improving the ACA rather than repealing it.
Hello, I am Devin Jackson, and I will be speaking on what are some of the key challenges facing state and national policymakers given the current state of the Affordable Care Act. Some of these challenges include policymakers seek to have courts strike down the ACA pre-existing condition protections, premium subsidies, and Medicaid expansion. Together, these developments have challenged state makers from across the political spectrum to explore options for safeguarding and approving residents' coverage. Other challenges include concerns with federal policies, promoting limited coverage products for sale outside of the individual market, and concerns about the affordability of comprehensive coverage and uncertainty about the durability of the Affordable Care Act have also put the responsibility on state policymakers from across the political spectrum to explore options for safeguarding and improving their residents' coverage. Most recently, challenges involves the ACA requirement that most private insurance plans cover recommended preventative care service without cost sharing. Also, cutting or eliminating financial assistance for ACA marketplace consumers and taking other steps to reduce the federal role in promoting access to coverage. Lastly, Medicaid waivers that could cause hundreds of thousands of low income adults to lose coverage, and the elimination of automatic re enrollment for returning customers.
Hey everyone, my name is Kareem Gomez, and I'm here to talk about if the Affordable Care Act was a good law or a bad law. As we know, everything in life has its pros and cons. So first I'm going to talk about the pros of the Affordable Care Act and then the cons. So let's start with the pros. Let me start by saying that we can only judge good or bad by how the Affordable Care Act has helped or not helped the people it was intended for. There have been many studies that have examined the impact of the Affordable Care Act and have found it to have a positive impact on health insurance coverage, Medicaid expansion, parental coverage expansion, individual mandates, cost sharing, and employer mandates for lower income individuals. Studies have shown that the Affordable Care Act decreased the uninsured rates and the insurance instability for its intended population groups. These groups include adults aged 19 through 25, lower income families, and minority populations. One of the major components of the Affordable Care Act was the expansion of Medicaid eligibility with non-elderly adults with an income up to 138% of the federal poverty level. Under the Affordable Care Act, insurers were no longer able to deny coverage to individuals due to pre-existing medical conditions. Coverage was expanded for young adults who claim themselves as dependents. This pretty much meant young adults could stay on their parents' health insurance up to the age of 26. Now, time for some of the cons of the Affordable Care Act. The evidence of direct impact of health outcomes are scarce, as there is no direct correlation between Medicaid expansion and the improvement of population health in the United States. The Affordable Care Act has given us mixed results, as every state did not fully or substantially expand Medicaid. Because of this, the Affordable Care Act eligible population who had difficulty affording medical care had decreased only by 3.5%. Approximately 14 or 15 states have not adopted the Medicaid expansion programs, and this resulted in states that did not expand to have increased Medicaid spending by 5%. The administration after the Obama administration had taken steps to undermine or modify the Affordable Care Act. For example, funding was cut for the open enrollment outreach program from $100 million to $10 million. This is part of the reason why the Affordable Care Act has been unable to seize full potential. Also, plans under the Affordable Care Act have not proven to be as cost-effective as promised by the Obama administration. Many adults have chosen to forego their insurance as they cannot afford the premiums. And despite the significant improvement in insurance stability, 25% of the population still experienced an uninsured spell within a 2-year period. Furthermore, health disparities across ethnic groups and regions still exist throughout the country.